So please do tell us what kinds of things you would like to share that you would like people to know about regarding this kind of surgery. Is there anything that you'd like to talk about regarding just the results or the process?
I personally never liked the factory model that came with me at birth. That was never the thing that ever really did much for me. So I decided to, modify the factory model, and I went and got a model that was a 2015, a late 2015 Thailand model, where I had a technique that's still largely not available in Western Europe and North America. I had what is known as a scrotal vaginal graft, where my scrotum has been grafted in to create a vaginal cavity. So the contracting muscular tissue that inside the scrotum is retained to give me a contracting vaginal canal. And I have retained my prostate. I have also retained all of the bulbar urethral glands, so I have natural lubrication. But the downside for me personally is that I have to manually keep my vaginal canal open. So if I am being someone who's not interested in the long term, when I say long term, I mean it takes about an hour for me to do the longer dilation that I do, I will simply use something that you can get, which is a silicone-based, wearable, insertable vaginal dilator. You can purchase these on the internet, and they are designed for cis women with vaginal atrophy, but they do work well for trans people as well. And you can wear these, and I do wear these to help keep me open if I don't really want to go through, and I'm not looking to get that long depth that I need to do. But to retain that long depth, I do need to occasionally go for the slightly more bulky and medical grade dilators that I have here. So the box that I got, there are 4 dilators in here. There is a small, there is a medium, and there is a large here. This one here that you can see, this is the travel dilator, and this one is a large white insertable I'm not quite sure what it's made of. I think it's made of a very hardened plastic. It is white. It is 32 millimeters in diameter, and it is 21 centimeters long, whereas the clear acrylic large one is 34 millimeters in diameter. And in order to keep the vaginal canal open, I have to insert this once a week. So it is an undertaking that I have to do. So this large insertable stent, which is effectively what it is, has to go in to keep the canal open to prevent it from collapsing. I can typically get about 18 centimeters of depth when I am doing this, and it does go up to, as I said, this is over 24 centimeters long with a 34 millimeter diameter, and that's the largest one that I have. If you are interested, you can go for slightly larger ones. I do know friends of mine who have got 40 millimeter width stents, but you can't really increase your length. You can increase your width to, physical maximums, but what you will hit is, the reason that I can't go any deeper than 18 centimeters is because I've hit my pelvis. I've physically hit the top. I can't go any further. My prostate is there and my pelvic bone is there, and you can't go any further with this. But I can typically get to about 17.5, 18 centimeters with this lovely clear stent, and it is virtually indestructible. It is designed to last. I've had this nearly 7 years now, and it is still going strong. But when I went to Thailand, these are the ones they give you as the medical aftercare ones, and I was having to do it 3 times a day for 60 days, and then it was twice a day for a further 90 days, then once a day for a further 90 days, and then you gradually phase it down. But your mileage may vary, and it will vary depending on the technique that you have done. So if you were to have a standard penile inversion technique, you'll have a different result than what I have. You may have a different look to what I have. From my understanding and the research that I did, the penile inversion technique gives you slightly less depth, but it is a much simpler procedure. So what are you after when you are having your factory model genitalia created and transformed into man-made wonders of surgical crafted genitalia? So are you after something which is going to be functional? Are you after something that's going to be depth? Are you after, lots of, deep penetrative sex? Or are you after it just looks like a vagina and you're not really interested in penetrative sex? I mean, I myself have done professional pornography, and I've had people on set comment that they would not know that my genitalia was any different to genitalia that was factory models. So this is the stuff that they'll give you. So the large clear perspex stent is the standard kind of physiotherapy that you will do, but I have also graduated to, I want to keep the end open because I've got some nice bullet toys that will slide in quite nicely. And if I'm just being lazy and I don't want to, get out like a large dildo or something and go all the way in, then I will simply use something smaller, which is going to keep it open so that I can just have some bullet fun. And it's personal preference as to what you personally want out of your genitalia. Are you after something which makes you feel good, where you can sit down, go to the toilet, and you're not really interested in having lots of sex? Whereas I love sex. I really do. It's wonderful. It gets my endorphins going. And for me, a lot of depth, and I was desperate to find someone who could allow me to self-lubricate, because that was the one thing I didn't want not to have. And where I have done some elements of professional pornography, that was a bonus when I was doing that as well, because it gave that sense and that aura, because I wasn't doing professional pornography in the niche that is, quote, trans. I was doing it in the standard female. So it was allowing my genitalia to pass more easily in that niche. So your mileage will vary. For me, I'm very happy. You will hear wonderful scare stories from people that, they can always tell, it's just a dick that's been shoved up inside. It doesn't lubricate. It's horrible. Nah.
I mean, as if that wasn't what happened organically anyway, right? Like,
Right.
I think people would be very upset to realize. But it's worth noting that these are, in fact, medical assistive devices. We're talking about dilators and stents. But I just really appreciate that my professional career has taken me to the extent that I get to talk to somebody about medical grade dildos for a living. This is fantastic. I love that we're having these conversations.
And you don't just get one, you get 4 medical grade dildos in 4 varying sizes, as you can see. You've got your large one here, which is your 34 millimeter. You've got your medium sized one here, which is your 32 millimeter. It even says 32 millimeters stamped on the bottom of it. And then you have your smaller one. So if you've been a bit lax and you haven't done it for a while and you want to open yourself back up, you've got your smaller one, which is a 26 millimeters. But the problem that you have with this one is the end of it. It's actually quite a sharp end. Whereas if you compare the two ends, I don't know if that comes out. This one is a lot sharper end. This is a much duller end. So you have to be very careful when you're using this one that you don't accidentally push too hard, because you can, in extreme circumstances, if you really are pushing quite hard, you can do yourself a little bit of damage with that one. So when I was first starting, they would advise you to use this one with caution because it was very tender. So they would advise you to start off with your medium-sized one, which was this one. And if you really needed to, then drop down to your smaller one. But if you could, they would prefer you to use the larger one because it was much easier and much more of a rounded end to it.
Yeah. Well, I really appreciate you walking us through that experience. You said that you had had these for 7 years now.
Yeah.
What can you tell us about I suppose, not just like the immediate healing process, but the experiences of patients with their bodies in the years and even decades after they've had this type of procedure?
So one of the weirdest things that I experienced, and it's something that I will still never get used to, and something that if you do go and experience what I experienced out in Thailand, and particularly with the technique that I have, but it is true for other techniques. I think it is probably a universal maximum. Your mileage will vary, but for me, the weirdest thing was having nerve reconnections. I will never get over feeling parts of my body reconnect with the nerves that were there. So when I was experiencing things such as nerve experiences in my clitoris for the first time, so it would be
Mhm.
a shock that I would experience. That was incredible because I was feeling that they were waking up, and my brain was remapping itself, and
Yeah.
that was the most incredible thing to me because I knew that my brain was going, yes. I know what was here, and I've now got to reteach myself what is now here. And my brain, in a way, was going away from what it didn't like, which was, oh, you've got a factory model penis. Oh, this
Mm.
isn't very nice.
Yeah.
To now go, oh, you have modified that factory model penis into this handcrafted, godlike creation of a vagina, which you have always wanted and you never thought you would get. And that is fantastic.
Mm.
So, me, the healing process, it was a long healing process. It was 12 months out of my life, but it was the 12 months that I will always remember because I'll always remember the first time I had sex with
Mm.
somebody who had a penis for the first time. And that was one of the most gender affirming things I have ever done in my entire life
Mm.
because at that moment, the one thing that caused me the most dysphoria was having a penis.
Mhm.
And then realizing that I no longer had a penis, and my brain then going, this is at the front that this is going in,
Yeah.
not at the back that this is going. This is at the front this is going in. It made the experience a real epiphany for me. It made that experience really explode for me. And it was one of those moments where it was just like, this is how I imagine a nirvana type experience of sex
Mhm.
to be. And for me, that was just gorgeous to the back teeth.
Yeah.
So you will have fabulousness, but you'll also have difficulties. You will lose a lot because it is a traumatic experience. For me, getting back to the physicality that I had beforehand took a long time. And I was told by a friend, get yourself in the fittest shape you've ever been in your life because you're going to lose it because you're not going to be able to do anything for a year. I spent 7 days on my back in a hospital bed, unable to get out of this bed. I had a catheter in, had everything that you could imagine after a traumatic surgery. And it was really one of those moments where you just go, I really have done something quite enormous, not just psychologically here, but physically here. I have transformed a part of my body into something that is non-standard.
Hmm. Yeah,
And
I don't want to
yeah,
be careless in the comparison or overly blasé about it, but I had an experience where I had a massive cut on my knee, and it took a couple of years and honestly a pretty emotional experience for me to like regain that sensation in that knee. And I think about what if I had had that experience like on my genitals, on my clitoris. That feels incredibly overwhelming. You know, we see these YouTube videos of people experiencing a like cochlear implant and maybe hearing for the first time or hearing for the first time in a long time. Uh, is that at all an accurate way of thinking about your experience?
for me, when I sat down on a toilet and urinated for the first time, that's how I would describe it. Sitting down and realizing that it was completely functional for what it was designed to be functional for. So my urethra was working and I could sit down and I could go to the toilet. that was just incredible.
Mm,
That
mm-hmm.
moment in and of itself was incredible, because that is what I had always wanted. Yeah, the sex was a bonus, but
Sure.
to be able to sit down and take a piss was just incredible. Yeah, I could sit down and take a piss with a penis, but it would hit the bowl.
Sure.
Whereas I could sit down, take a piss, and it didn't hit the bowl. My skin didn't touch the porcelain. It was just incredible. And I could sit there and I could go,
Yeah, well, I appreciate the both like physical and then I could say emotional. I might even say like spiritual experience of having that transformation and that maybe affirmation of your body.
absolutely. For me, my greatest source of dysphoria was my penis. And to be able to eliminate what was the greatest source of dysphoria for me was incredible. And it's going to vary by person, and your mileage will vary depending on where you go. And I'm not trying to say that everyone's going to have results as amazing as I have. I know that I got very fortunate, and I was in a position in my life where I was able to afford to go to Thailand. Not everyone can afford to go to Thailand, and it was a very privileged position that I was in. But I took advantage of the opportunity that I had. No matter what people were saying, oh, you're going to Thailand, oh, it's dangerous, oh, you're going to have... Yeah, it was dangerous, but all surgery is dangerous.
Sure.
Yeah, I was flying to the other side of the world. But so what? This meant more to me than any of the dangers that I was going through, because it alleviated the biggest source that was holding my life back.
Mm-hmm.
And after I had eliminated that issue, I was able to start doing other things with my life. I know that other people can say, well, I've been able to get on with my life in different ways and it wasn't such a big issue. That's perfectly valid as well. But for somebody like me and for other people that I know, being able to get over that hurdle allowed me to move on to the stage of my life where I'm now a much more wholesome and a much more rounded and a much happier person. And going to Thailand to see the surgeon that I did, there was a whole community of people there. I was in Thailand for 7 weeks. So I was in hospital for 1 week. They had you in Thailand a week before, and they made you stay for a minimum of 3 weeks afterwards. But I was playing it safe and I wanted to see a bit of Thailand as well. So I stayed a week earlier and did some exploring around Thailand, and I stayed a couple of weeks later. And I was quite relieved that I did stay a couple of weeks later, because it's horror story time. So warning here, I'm about to talk about something where it went slightly wrong. I had clitoral hood separation, and I had to have a revision done where they re-sewed my clitoral hood so that it was all nice. But that was the only thing that I had. So things can go wrong, and it did go wrong for me. But it was fixed, and my clitoral hood is as good as it could possibly be. But that's surgery for you. And, it was a risk I was prepared to take.
Well, let me ask you this, and I know this could be a little bit overly specific or may not be something you have a strong stance on, but it does make me wonder if you can imagine a world in which you're not having to fly to a foreign country to have this type of surgery, and whether or not you believe that you would have perhaps had a more straightforward, easier experience if we didn't live in such a transphobic world, or a world where transphobia has become such a specific dog whistle to gin up votes and create conflict.
Absolutely. The problem that you have is that whilst transphobia and ginning up votes is seen as this abstract thing for society, it infiltrates the medical sector, and it infiltrates the medical sector quite heavily, insofar as these techniques that are cutting edge for advancements in genital surgery for trans women and trans men are largely seen as, oh, we can't do that, it's too complicated, we don't want to do that, I'm used to doing it my way, I'm going to keep doing my surgery my way, my penile inversion technique is the one that I'm going to keep doing because that's what I know what I'm going to do. I'm not going to perform simply an orchidectomy because if you just want that, then why am I bothering to waste my time with that? Why would I want to have somebody that has to have this long recovery time afterwards? Why would I bother? This works perfectly well as it is. Forgetting that, you know, advances in technology are things that should be embraced and shouldn't be shunned. We, particularly in the United Kingdom, where I'm based at the moment, are notorious for being stuck in the dark ages. So I was never going to go to an open ward, mixed ward potentially after having surgery that lasted 2 hours to go and stick my penis inside and go, yep, we chopped off a load of it. You've got to, you know, lubricate yourself. I was prepared to fly to Thailand because the transphobia that is in my country prevented what is not today cutting edge technology from coming in and displacing what is old style technology, whereas we should be continuing to push the envelope. Mm-hmm. You wouldn't say with cancer treatment, well, okay, we've cut out the tumor, but radiotherapy has its downside, so we're not going to bother with that. You just wouldn't say that. So why do we say that here? There are risks and downsides with everything. So why do we stop here? I would have loved not to need to spend thousands of pounds and to have other people that I know spend thousands of dollars to fly to a different country because the institutions are stuck in an era of gatekeeping, comfortableness, and quite frankly, whatever your dog said.
Excuse me.
Of comfortableness, of quite frankly what they know to be best, and therefore they know it to be best, so therefore they're going to do it. If a new drug came onto the market tomorrow that was able to reduce symptoms in a disease or to cure a disease, and a doctor was to turn around and say, well, this drug that I've been using that can, you know, make you not have this, that, and the other, but won't cure you, but I could use this drug that will cure you, and they would say, I'm not going to use the drug that will cure you, I'm just going to keep treating the symptoms. You'd start to question that doctor's, you know, wherewithal. So why is it acceptable not to push the envelope in the UK, in Western Europe, in North America? Why is it that countries such as Thailand, such as Taiwan, such as South Korea are pushing the envelope? Why are they doing it and why aren't we doing it?
Mm-hmm. Yeah, that's a really great point that you're making there. I'm glad you brought that up. And I so appreciate you coming on and just sharing all of this with us. I think we learned a lot of information tonight that a lot of people don't know about, and I definitely learned a lot. And, you know, you've shared your personal experiences as well as putting it in context for us. What if people want to learn more? Where can they go? Are there podcasts? I hear you might have some resources you can point people to, or any other resources that people might be able to learn about this.
If you want to learn more just generally about trans people, I do have my own podcast called Transition Stories, where I interview non-cisgendered people about their transition and what gender and gender identity means for them. But the best thing that you can do is research. And you've got to evaluate what you think is going to be best for you. So are you going to be able to manage a 12-month recovery time? Are you going to be able to manage that? Or is a 6-month recovery time something you can manage? Are you going to have those structures around you? What exactly do you want out of your own genitalia? Do you want genitalia that you have to stick something like this small red silicone wearable dilator in to keep the end open on a regular basis? Or do you just want something that looks like a vagina, that you're not very interested in that? What exactly do you want from it? And those are the questions you have to ask yourself. So There is a massive community out there. I wouldn't normally plug Reddit, but there are massive Reddit communities out there. There are individuals on there who will be able to point you into more directions where I am. And ask surgeons themselves. Email surgeons. Ask surgeons about their technique. If they don't get back to you, is that someone that you really want to go and give your genitalia over to? If they can't say, well, this is my technique and my technique is this because. If they don't then say to you, well, it's there on the website. If you're asking questions and they don't get back to you, that raises a red flag for me. Whereas if a surgeon says, okay, here's the upsides, here's the downsides, here's results that I have done, here's some of the things that have gone wrong in the past, here's how we've corrected them, here's papers as to what I have done, here's some research I've done. If they're saying those things to you and they give you the information so that you can evaluate it, that's probably someone that you're more likely to get a better result out of because they're open with you. And simply do what is making you most comfortable. Don't take because someone's given you a flashy sales pitch. Don't do it because someone said you must go and see this surgeon. They must go and see that surgeon for themselves if they are saying that. You must go and see the surgeon that makes you the most comfortable. And if you are comfortable seeing that surgeon and you are comfortable with the results you have seen and you are comfortable with the research you have done, then go for it. If you are uncomfortable doing it, then ask yourself why you're uncomfortable.
Good advice.